recording today's webinar. So just to let you know that. Welcome, good afternoon. I'm Heather Drake. I'm the Membership and Engagement Director with the Maine Public Health Association. And I'm so happy to have all of you here today and participating in today's conversation about what is gender affirming care, exploring and remedying the gaps in accessing healthcare for transgender youth in Maine. I'm really excited to have Sue Campbell and Aiden Campbell with us from Out Maine, and I will introduce both of them in a minute. Today's webinar is part of our health equity series on moving from information to access to action, and how we can really start to operationalize some of our learnings around health equity and make collaborations more effective and better outcomes. So today's webinar, as well as a series, was developed by our health equity member section. So many thanks to all of those folks for making today happen as well. A couple of housekeeping items, as you've probably already been alerted, and as mentioned already, we are recording today's webinar and we'll put it on our website and send it out to registrants afterwards. And you can also find on our website other upcoming webinars in our series. And I'll try to stick some of those links in the chat as well, so that you guys are able to register for those as we go through today's presentation. I would love it if you could introduce yourself in the chat, where you're calling in from today, how you're feeling. Let's get to know a little bit who's more in the room. We do ask that you stay muted until we get to the Q&A. Once we've heard from Sue and Aiden, we'll spend a few minutes doing questions. And you can either put those questions in the chat, or we're a small enough group that you can feel free to come off mute too during Q&A. And then we will be doing breakouts, so we ask that you please participate in those. I know they're not always everybody's favorite, but it's part of our idea and how we can begin talking about what we're learning about, and think about some actionable items moving forward. And then there is closed captioning available. Whoops. Save that one for later. So with that, I would love to introduce Aiden and Sue. Aiden Campbell grew up in Maine and transitioned from female to male in high school. He graduated with his Master's of Social Work in 2019 from the University of Southern Maine, and has over 7 years of diverse experience working with both at-risk youth and their families. He brings his experience as a clinician along with his personal experiences to educate, support, and uplift LGBTQ+ youth across Maine. And he's currently the mental health coordinator with Out Maine. Aiden is joined today by Sue Campbell, who is Out Maine's interim executive director. She brings more than 25 years of experience working with school superintendents, administrators, and other school staff through her work on local and state school boards. She volunteers with the Trans Youth Equality Foundation in Portland, assisting with support groups. And as a parent of a trans son, her firsthand experience in supporting the transition process and working with family issues around transition has given her expertise that supports both youth and families. Aiden and Sue, thank you so much for being here. I'll now turn it over to you for your presentation.
Awesome. Thank you so much. I'm going to share my screen, so let me know if you can't see something. All right. Yeah, so today we're going to talk about what is gender affirming care and some of the things that there are, and a lot of the gaps that there also are in trans care. My name is Aiden Campbell. I'm the mental health coordinator at Out Maine, and I use he, him pronouns. And I have Sue with me, who is the interim executive director, and she uses she, her pronouns. So some of the things we're going to talk about today, we're going to kind of just do an overview of what is Out Maine. We're going to go over some definitions that you might hear. There are a lot, so don't feel like you have to remember them all. We have a resource of definitions for you to take with you. We're going to talk about some barriers to care and how to address some barriers, and then we'll have some time for questions. So Out Maine, our mission is to build welcoming and affirming communities for LGBTQ+ youth. And we're the only statewide organization that has focused exclusively on LGBTQ+ youth for the last 25 years. And we have a 4-tiered approach to meet our mission. So the first tier is our direct youth work, which is aimed at building communities and connection for LGBTQ plus youth. We host 3 weekly youth groups online. One is for ages 9 to 12, one is for ages 13 to 17, and one is for ages 16 to 22. And these groups provide the youth with a space to build community and connection, explore their gender identities, explore their sexual orientations, build leadership skills, and capacity to transition healthily into adulthood. We also do retreats, and Rainbow Ball we had this spring for the first time in a couple of years since COVID has been going on, which had a great turnout. We had like 200 people there, and the youth had a great time. Our second tier is to provide resources and support for parents and family. 40% of homeless youth identify as LGBTQ plus, and about 30% of youth are in foster care. And the support that we provide to help families keep youth in their homes and includes, and we have a two times a month parent group. One is in the evening and one is around noontime for like a lunch check-in. We do family events, and we also do like one-on-one consultation if parents need some extra support or have specific questions. Our third tier is creating welcoming and affirming school districts. And we use an integrated approach to support schools wherever they are in the process of supporting LGBTQ plus youth. We help schools strengthen their policies and procedures, provide professional development for staff, education for students. Schools establish gay, straight, trans alliances, or we also support those that already exist in schools. There are studies that show that any school that even just has a GSTA can help reduce bullying and harassment for all of their students by more than 50%. Our fourth and final tier is building a network of trained professionals, which is key to developing welcoming and affirming communities. So we have our training program, which provide education and tools to a variety of providers in local communities so that they can support youth in their healthcare and behavioral health practices, religious communities, youth programs, and other community programs. So some definitions that we're just going to talk about a little bit. So these are just kind of some of the basic definitions that you might come across. So we have male, female, transgender, non-binary, genderqueer, queer, and gender nonconforming. So we all have a gender identity, and our gender is what our brains and our bodies tell us that we are. So male and female are probably the genders that you've heard of the most. So for many folks, their gender aligns with what the doctor assumes based on their genitalia at birth. But for other folks, it does not. There are hundreds of books and studies and podcasts that explore what gender actually is. But the important thing is to know in this context is that gender is created by a combination of biological and cultural factors. So something else to remember is that sex and gender are different. So sex is a combination of biological, anatomical, chromosomal, and cellular characteristics. And we're learning that sex is not as binary as we once thought. And gender is how someone feels in their body, regardless of their sex. The most important thing to know when talking about gender with LGBTQ plus is that identity is different between cisgender and transgender. So when a baby is born and the doctor says it's a boy or it's a girl, and there's an M or an F that's put on the child's birth certificate, and if that child grows up to be a gender that the doctor stated, that person is considered cisgender. So when your gender identity matches your sex, you're cisgender. Whereas the opposite side of that is if someone's gender identity does not match their sex at birth, then they're considered transgender. So for me, for example, I was born female at birth, but I identify as male, so I would be considered transgender. And there are many different ways of being transgender, and there are many, many, many different gender identities too. So if you're interested in more definitions of more genders, we have a terminology page on our website, and I will show you how to get there also. So transgender is an umbrella term for someone whose assigned sex at birth does not match their gender identity. We have non-binary, which is someone whose gender is not strictly male or female. So gender is spectrum, so they may fall kind of anywhere within that spectrum. And they have gender nonconforming, which is someone whose gender expression does not match the societal expectations associated with their gender. So, for example, for gender nonconforming, a cisgender boy who identifies as a boy but likes to wear dresses, or a transgender woman who doesn't shave her facial hair. So gender nonconforming people can also be straight, gay, trans, bisexual. So for terminology, this is a screenshot of our website. You can go to outmaine.org/resources/terminology. Or if you go onto our website and you go under the resource tab here, it'll drop down and you'll see an option for terminology, and that will have a more extensive list of terminology that you may hear. And it's not necessary to know all of the different terminology. There's a lot out there, but just kind of having a general idea of the ones that are more common can be helpful for you. So how many transgender youth are there in Maine? 3.2% of Maine's high school students identify as transgender or have said that they're unsure of their gender identity. And there are transgender youth in elementary and middle and high schools in every county in Maine. And 17% of high school students identify as gay, lesbian, or bisexual, or they're not sure of their sexual orientation. So that's 11,000 high school students, which is over 1 in 5. And this came from the Maine Integrated Youth Survey in 2019. And they do this survey every 2 years. Because of COVID, it's been postponed. So they should have the data for that fairly soon. So healthcare needs and lacks. So some healthcare needs. So all general healthcare needs are needed for everybody. Hormones for transgender people, surgery referrals, puberty blockers, mental health providers. So transgender youth need all the same healthcare services that non-transgender youth need. And there are 2 major barriers that transgender youth experience when attempting to access non-trans related healthcare. The first is that doctors' offices are often unwelcoming, non-inclusive, and potentially threatening place for transgender people to be. This ranges from seemingly small things, such as just a lack of option on intake forms, being called the wrong name, or having to go to a women's health center to get reproductive health care, to larger harms, such as regular inappropriate questions unrelated to healthcare needs, and unnecessary and violating physical examinations. These unwelcoming environments and the fear of stepping into an unwelcoming environment stops a lot of trans people from accessing just general health care they need. There's also the trans broken arm syndrome, which is a term that refers to a phenomenon where providers kind of assume that all medical issues are related to a person's transgender status. So this could be anything. It could even include broken arms. And this assumption gets in the way of providers feeling competent in treating any issues a transgender person might bring to a doctor's office. So secondly, many providers feel uncomfortable treating trans patients, even if that patient is not needing any sort of gender-related care. Being able to find medical or mental health providers can be challenging because many providers are under the false impression that trans patients are out of their area of expertise, which results in a lack of providers who can offer foundational healthcare services. And in terms of trans-specific care, gender-affirming hormones and surgeries are not usually offered to people who are under the age of 18. Puberty blockers are medication that postpone puberty, which are offered to prepubescent teens, but this is usually prescribed and managed by gender clinics, which we have 2 of in Maine. We have one in Portland, which is the Portland Gender Clinic, and then we have one in Bangor at Northern Lights Hospital. For transgender youth, an affirming medical provider will be creative in finding safe solutions for youth who are looking to transition. And some of these could be providing a form of birth control that would limit the regularity of menstruation, or teaching a patient about safe binding techniques. Some ways to make your office more safe and inclusive and welcoming could be having gender neutral bathrooms, asking and using names and pronouns at a check-in desk, sharing names and pronouns on name tags, having options on forms at intake, having inclusive literature in exam and waiting rooms, having inclusivity training for all of the staff, not just the providers specifically, and info on how you provide gender affirming practices on your website. And primary care providers and mental health providers should be able to serve the whole person. So hormone therapy and referral should not be specialized. So how do we address these lacks? So there's kind of two areas here. So at Out Maine, we're working on a multi-year project designed to improve healthcare and mental health services for transgender youth. So in the first year of this project, we gathered a group of transgender and gender nonconforming youth to identify ways to improve their experience when they're seeking healthcare and mental health services. And this is a group of youth that we called the Trans Health Action Team, which reviewed research and participated in a series of focus groups and surveyed medical and mental health providers to assess their needs. And then based on that analysis of data, the Trans Health Action Team developed a list of resources needed to improve the services for transgender youth in healthcare and mental health settings. So we made sure that we included medical providers and mental health providers, and then also that we asked the trans and non-binary community directly. So some of the resources that were thought of in the first round of the Trans Health Action Team were podcasts, videos, waiting room and exam room posters, a binder program for trans youth to access safe binders, a best practice guide for mental health and medical providers, how-to materials, an inclusive coloring book, decision trees and flowcharts, transitioning options, medical and mental health specific trainings, welcome packets for patients, and resource packets for parents. So in the next phase of this, the Trans Health Action Team is developing these practice kits, which will include a set of resources for healthcare and mental health providers to use in their practices. And this is something that we're developing. And once we have it done, we'll have it on our website for folks to access for their practice. Some of these things we do already have available. We have a binder program that is available for anyone under the age of 22, and our program provides safe and reputable binders. We do this because wearing a binder, which is a compression undershirt, can be a critical item for trans masculine and non-binary youth who want a flatter looking chest, and binding can be really dangerous if it's not done correctly, or if there's a binder that's not the correct size or it's poorly made. We also currently have a day-long training for mental health providers and are developing a series of trainings for medical clinical staff. And these will go alongside with the best practice guides. In addition, we also have launched a self-paced online training portal, which is at mainqueerspace.org, which includes training modules for professionals working with LGBTQ plus youth. And these modules provide both foundational knowledge and more in-depth knowledge for mental health providers and educators. We also are creating how-to materials for providers to share with clients that include information on how to safely wear a binder, how to legally change your name and gender marker, how to tuck safely. And alongside with that is the inclusive coloring book, which we are having our youth also participate in. So they're submitting design ideas, and then we're going to have them kind of recreated to all be the same kind of structure and format, and then we'll develop a coloring book out of that. We'll have a simplified decision-making tree about different transition options and packets of information for patients and parents. And we, if you would like to be on a list to be alerted about when the resources are available, please just let us know and we will make sure to add you to that. Yeah, so we'll do questions and then we'll do breakout rooms. So I'll stop sharing my screen so I can see everybody. So does anyone have any questions? I know that was a lot of information. So also if you just need a minute to take it in, that's okay too.
Thank you both. It looks like Deborah is raising her hand, and feel free to actually raise your hand. I can't see all of you, but I'll do my best, or use the raise hand feature, or you can enter it in the chat.
Hi, Eden. Thanks so much for the presentation. I'm wondering if you work at all with the Fenway Institute LGBTQIA Health Training Center, which does in-person trainings as well as has an enormous variety of resources.
Mhm. Yeah, so we, and maybe Sue can answer this better. I have definitely heard of them, and I know I've actually looked at some of their trainings to do myself. But for collaboration wise, I don't think we have worked directly with them. I don't know, Sue, if you have more.
Yeah, we haven't worked directly with Fenway. They are an amazing resource. We've tried to create our partnerships with providers that are here within the state of Maine. So we've been partnering with the Maine chapter of the American Academy of Pediatrics and the Northern Light Gender Clinic around some of this work, but we've absolutely used some of the resources that have been available through Fenway.
Thanks.
Cool. And then I see April said in the chat, do you have a rough estimate for when the resource guides will be created by the youth groups will be completed? So we've already started developing these resources, and we currently have them kind of in a review period. We've been working with some providers around the state to get some feedback, and then editing to finalize them. So the first year of this project is to create all of these resources. So hopefully by the end of the year, we'll have them done, and then we can release them in 2023. Let's see. And then I see, do you have health systems and hospitals that invite you for trainings? So August Sender, who is our training coordinator, has done trainings all throughout the state with different with all sorts of different hospital and healthcare systems and schools, and just other providers as well, mental health practices.
And so I see the question about school boards and school administrators. Yeah, we absolutely do trainings with both school boards and school administrators. We do lots of trainings. Over the past few years, we've trained over 15,000 people across the state. Many of those are schools. So if you are interested in any level of school training, whether it's for staff, administrators, school boards, just reach out to us, and we can provide you with some information on what that is. So if you can either go to our website, or you could email either Aiden or I, and we'd be happy to connect you with the person who does that scheduling. I can stick our emails in the chat for you as well.
And then our trainings, how long are they? We have a variety of trainings, so it depends on the training. We have some that are like an hour, 2 hours. We have half-day trainings. We have full-day trainings. We have a full-day clinical training. So there's kind of a variety depending on what you're looking for. Until resources are available, any tips for making exam rooms more friendly? So some ways I would suggest, when you have people come in, asking what name and pronouns they would like you to use. And if sometimes that might feel awkward, you can always introduce yourself and just be like, hey, my name is Aiden and I use he, him pronouns. And then that kind of sets the tone for them to also introduce themselves with pronouns. We do have some posters that we are recreating, but we have older ones that if you're interested in, you can get off of our website and we can mail them to you. We also have some other resources kind of about like what we do in general that we can mail out as well, that you can have in your office space.
The question about do the Maine gender health clinics provide hormone blockers and hormones and surgery to youth under 18? You'd have to you would want to reach out to each of the gender clinics individually to identify what resources they specifically offer. They have their process that they use working with youth and their families. So I can't speak specifically to all of the services that they offer, but I do know that, that you're going to get the most comprehensive care here in the state of Maine, but with either one gender clinic or the other. There are other providers in the state who will provide some care as well. But when you have a young person under the age of 18, the gender clinics are a really great place to start. And then many of the local providers will provide other care outside of what they need related to their gender identity.
And then I see what kind of data would we want to collect and track about healthcare provided for youth at primary care and gender clinics in Maine. So I think part of that is just even finding providers who do provide inclusive and affirming care for trans and non-binary youth. And then also kind of like, what are those resources that are offered? I know when I transitioned 10 years ago, there was nothing in Maine. I had to go to like Rhode Island to get hormone treatment for many years until Maine opened their own kind of thing. So I think just even being aware of what's around could be helpful. Cool. Are there any other questions that folks can think of?
I'm just going to ask it because it would take me too long to type it in the chat.
All right.
Just wondering, I'm pretty new to Maine, at least considering the gap in life of the pandemic. How is Maine legislation regarding like insurance for coverage for some of these treatments and some of these, the transitioning or supplies needed or care items? Is that something that Maine has a good grade on?
The coverage has actually been really pretty good. Maine Care, if you have patients that are on Maine Care covers a lot of the transgender affirming services that are needed as far as medications and the healthcare services themselves, and the same with the private insurances. We have private insurance, and there's never been a problem with having anything covered that was needed to be covered here in Maine. So we've been very fortunate in that respect. The question, I love this question, and thank you for asking it, because it's a question that doesn't get asked often enough, which is aspects of emergency response healthcare. It's really critical that the folks that are working in emergency response, whether that is EMTs or folks that are in the ER, are also, when you're working with patients at that point, it's a crisis situation, generally speaking, and this can be a time when you're very focused on what's the medical emergency that they're needing, and yet if you are not sensitive to what this person's needs are, it can be so traumatizing for an individual that they may never choose to seek medical care again. And so, being aware that you're working with someone who is transgender or, is exploring their gender identity and may be experiencing a lot of body dysphoria, and having to be up close and personal with that individual may be a very challenging thing for them. Making sure that you're getting their name right, and trying really hard to use the correct pronouns. We've seen situations where someone's legal name has not been changed, and it's so what goes on an ID bracelet in an ER is their legal name. And, and then people aren't making that effort to try to use the name that they've been asked to use. And those are the types of things, we want to be able to support people as best we can. And it's really recognizing these extra needs that are there for folks that, are transitioning or have transitioned, and what those needs may be. It's a it's a tough space when you're working in the emergency response sector for sure. I love this question too. So how does Maine define success when addressing the lacks? Every time we get another provider who gets a name right, we have another young person who tells us that they had a really good experience when they were working with their healthcare provider or their mental health provider. These are successes. It's going to be it's a journey. If I could wave a magic wand, all of these things would be in place in all of our systems. The reality is we know they're not. Every step forward is a positive step forward. So every time we can make a change, whether it's having visual images within the offices, ensuring that all of your office staff are trained, not just the providers, but also the people who are at the front desk checking people in, the people who may be calling patients to remind them of appointments. Imagine being a trans man who has to see an OB/GYN, and you get a call, and when they try to confirm, and then they're like, oh, I think I've got this wrong because we're an OB's office and you're a man. It's those types of things, like having people be really aware of what it is that they're working, who it is that their patients are, what those individual patients' needs are, and just really being as welcoming and affirming for all of your patients as possible. So in any of those steps forward, I think of that as a success. The more of those we can have to address those lacks, the better those successes are going to be, but it's all a step forward.
Go ahead, Liz.
I have a somewhat related question. I was really struck by what you said, the idea that some providers have a perception that this, gender affirming care requires specialization. How do you work with providers to kind of overcome that, and recognize what types of things can you do to encourage kind of that, not to have that view?
Well, sometimes it's really about, getting them into a room where we can have conversation through some level of training with them, and the recognition that, that there are really some things that are really small things that can be done that can really change the experience for our patients. And it's when they begin to really unpack that and recognize that they don't have to be an expert in hormone therapy to be a good provider for a trans patient, right? They can be more open when they're talking to their patients, use the correct names, recognize that, patients are going to have needs based on their physical bodies, which may or may not align with that gender. And, if you're a trans male and you have to have a mammogram, that's a very stressful experience for a trans man. But yet it's something that's really medically necessary. And so it's being aware of the needs are not different in many ways. And when you're talking about a lot of the primary care services that are needed, they're going to be the same as they would be for everybody. And so just being willing to be open and recognize that not everything that an individual is coming to a doctor for is about their gender identity. I mean, maybe they're having, maybe they got a really bad virus, right? Or maybe they've broken an arm. I mean, those are things that can be treated and treated with gentleness and kindness without even needing to worry about what someone's identity is.
Any other questions that have come up? These are great so far. And really appreciate you, Aiden and Sue, taking time to answer them.
Love to answer questions.
Yeah, something else that I also thought of, just to throw in here is, especially when working with youth, one of our primary concerns with providers is safety. So something you can do too is if you have a youth who maybe is coming out to you but hasn't come out to their family, and wants to be called a certain name or use certain pronouns around you, make sure you're checking in with them too to find out how they want to be referred to. If a phone call has to be sent home for a reminder appointment, or you're talking to the family about whatever, just to make sure that you don't accidentally out anybody, because we wouldn't want to put anyone in a dangerous situation.
You know, and our goal is to always get parents to be willing to be supportive, but you know, speaking from a parental perspective, when you first find out that your child may be transgender, it can be a very scary, scary thing to have happen. And you'll have a million thoughts going through your mind. And, you know, everything from, I have no idea what this really means, to, you know, what is this going to mean for my kid's safety at school? So there's a whole range of things, and parents are going to need some support and need some connections and resources. And some of that may be access to information for the gender clinic. Some of it may be access to information for, you know, getting questions answered for parents. So, you know, directing them to some of the parent support groups, connecting them with resources in the local community for their children. You know, it's a whole variety of things that may be needed, but the recognition that, you know, knowing what the statistics are, not all families are welcoming, and so we want to make sure that we're supporting our young people as best we can, and trying to provide the right resources in that process. Is Maine law keeping up with the needs of the trans population? It's doing a lot of really good, stuff. You know, sexual orientation and gender identity are considered protected classes under the Maine Human Rights Act, which is huge. That's not the case in a lot of states. There is a lot of legislation across this country that is that's anti-trans legislation. Fortunately, we've you know, we're holding strong here in Maine, but you know, we can't assume that, you know, the laws that are there will always be there if we don't continue to advocate for them. You know, I think that Maine is one of the states that has done a reasonably good job of having laws to protect all of our citizens, including our transgender citizens. And so we keep marching forward with it, and recognizing that, you know, even with all the good laws that we do have, there's still a lot of work that needs to be done at the legislative level as well.
Yeah, and another thing just to add to that, I think it was last summer, we worked with the Department of Education to come up with some best practice guidelines for schools around how to support LGBTQ plus students at school. So there's resources specifically for that. If you have a school that you're working with that might be giving a hard time or might not know what to do with a trans student, their website has kind of like some best practices for the school, specifically for parents and for youth on there.
And you are quite right. The current Maine Republican platform does include anti-trans youth policies. You know, unfortunately, we're living in a world of divide at the moment. And so, you know, the thought that all of our youth aren't being supported in the same way is troubling. And so we you know, want to do what we can to make sure that all of our youth are feeling safe. You know, we are these young people have very high risk factors and, you know, high suicide statistics, and we don't want those to get any higher than they already are. So this work is really important, and the fact that you're all here today shows, you know, a lot towards the fact that you are wanting to do things in a way to help these youth feel welcomed and supported. I think of the public health is the same in many ways as the, when we think about healthcare or mental health, the public health is very much in the same way. It's, making sure that the right programs are in place, making sure that the folks that are working in the public health sector are, trained to recognize and use the correct names, the correct pronouns, having visual images available in your offices, programs and materials and resources available for the people that you work with. Often in public health, you are working with folks who may be in need of a lot of resources. And so helping those folks find the resources that they need and connecting them to the programs that are available for the young people, knowing what resources are out there, getting onto our mailing list so you can be aware of the programs that are happening not only here at Out Maine, but at other organizations throughout the state, so that you'll have those resources available when you need them. Those are all ways that, I think public health can definitely step up.
Thank you. These are all really great questions, and I love to see the engagement. We'll take one more from Liz, and then we'll move into the breakouts.
I'm so sorry. That last question got me thinking. I see there's quite a few folks from the Research Institute, Maine Health Institute for Research on the call today, and we study various points of intersection with the healthcare system here in Maine, and thinking about how to, represent the needs. How can we, I think there's been a movement at the Institute to want to center our community's priorities in our research questions and have them lead and drive what that looks like. And so I'm wondering if there are ways that we can be better allies in centering the trans youth health priorities in our research questions as well, or just in general, our LGBTQ plus communities health priorities in our research, and wondering if anyone has reached out to you, if there are ways that would feel good for that our research community to engage with you and create a collaborative relationship.
So the answer to that is a really big yes. We'd love to have more input into that as you work in that. We've done some work around some of the research, but limitedly. I think there's a lot more that can be done. And I think that as varying research projects come up, I think it's always good if you can reach out and get, ask for some input, feedback. The more we all think about this and, recognize that our youth have many intersectional identities. They're not all just one, there isn't all one factor to everybody, right? And so when we're thinking about these pieces, we want to be looking at what are those intersecting identities and how do we collect that information? The more information and data that we can collect, then the better off we're going to be. I mean, much of our data here in Maine, at least for our young people, comes through the Maine Integrated Youth Health Survey, because that's where that's where we can get access to information. But the more research and the more resources that are available, the better it's going to be for our young people across the board.
Thank you. And I'm glad we do have so many research folks and evaluation people who are participating today to hear that. So I hate to cut the question short, but I think we can continue these conversations in the breakout. So I'm going to share my screen again. So each room, we'll do 4 rooms. Each room will be assigned a facilitator. And then we also ask that you identify a note taker in your room to take notes and send them to me when you're done. And I can put my email in the chat again. And you'll also get a follow-up email from me if you lose it. So the questions we'd like you to talk about in the next 10 minutes are: what are the challenges or barriers you experience when working with transgender individuals? Or you can think on a personal level too, of just interacting. What types of resources would be helpful for you? And then what is one thing you can bring back to your work? So we'll let you all, and I'll copy those and stick them in the chat. Let's see how well I can multitask. And then if our facilitators too can just copy them and take them into their rooms too. So I will send us into rooms. Hopefully it works. And we'll bring everybody back, let's say around 12:55, and I'll give you countdown updates too on how much time you have left. So we'll send you off. And then for our facilitators, I'm just going to assign you each to a room. You guys should all be heading out. All right, it looks like we have most everybody back. We'll just take a couple minutes to share either the facilitators or the note takers to what everybody chatted about in your room. So I don't know if anyone wants to volunteer to go first.
As a note taker, I can just a couple, we spent, I think the majority of our time talking about the data side, like dealing with how we get some of these data collection instruments changed to be more inclusive and really collect the right data, both at this like small program level and at the state level, dealing with federal entities that aren't flexible and how we can figure out how to make those more useful so that we get better data and then therefore get better resources. Anybody else on the team want to add to that?
I just like to add that we could have used more time because we took a nice deep dive into question 1 and probably could have done fabulously with questions 2 and 3. So there seems to be a lot more to say.
Yes, and I think that was evident by the fact that I had to cut out the Q&A session. So definitely really an important topic that people are interested in. So any of the other rooms want to share what they talked about?
Yeah, I don't mind going. We talked about, once again, we also focused a lot on the barriers and we did a little bit around resources, but we talked a little bit about the, lack of knowledge when engaging LGBTQ+ youth, as well as when creating materials and resources, like we focus on creating these things so quickly. We don't necessarily always think from like that equity lens, so one of the examples that was brought up is like, for example, at the vaccination clinics, not having a non-gender bathroom available for people. So, we want to get those clinics out, but we're missing some of those smaller pieces. We also talked a little bit about data and making sure that the data we collect is being informed by questions that are of interest to people who are asking of it. For example, we're collecting information related to transgender patients. Do we have transgender individuals helping us inform some of those questions and data as well?
Thank you, April. And then anything from the last two groups?
I'll share that we also did bring up some of the federal funding and how a lot of that data collection and a lot of that asks sex, and it's in reference to sex assigned at birth. And so that came up in our group as well. We also talked a little bit about some resources that we could use. So from the cancer perspective, looking for resources for how needs would be different for this population. We talked about how resources for facilitating change in larger organizations and how we on the ground level can bring that back to like corporate level. And then also about how we often have to use evidence-based programming in our, in the subs work, in our tobacco work, things like that. So how we can make sure that it's gender affirming when we're using these big blanket programs. And we did learn that we can do one-on-one consultations without Maine. So great to know.
You can.
And then Liz, I see you said you talked a lot about the need for institutional organization policy to support best practices and standards of care. So that's upheld across centers and systems. And yes, definitely thinking about individual care and working with patients, but also how can we change the systems and policies and programs that are enabling in positive or negative ways, different practices to occur. So we have 1 minute left. I'm going to ask, we have one final poll that we would like everybody to take. And so if Liz, you don't mind sharing your screen and putting that link in the chat. And while you're doing that, I really just want to thank Sue and Aiden so much for being here. This is obviously a topic that people are very interested in and have a lot of questions about. So I think this has been super beneficial to everyone. So thank you so much. And in that vein, the Mentimeter question is, what would you still like to learn more about? And so you can just go to menti.com and put in the code 1564798 that you see up there. And then I think it looks like Liz is putting it in the chat too. And I know we're at 1, but I'll stay on for a couple more minutes so that people can do that. And that'll be collected and saved too. So we'll have it as well. So thank you so much. We'll follow up with links to Out Maine, to the recording and the links that we sent out earlier with the reminder email. So thank you so much, everybody. We really appreciate you attending today. And again, I'll stay on for a couple more minutes so that folks can take the survey or this poll question. But have a great day. And Sue and Aiden, we can send you this too if it's helpful. I don't know how. We could also, I'll send the link in the follow-up email in case other people want to take it after the fact, if it would be helpful.
Okay, that'd be great. And I'd love to see the summary of all the notes from the breakouts.
Definitely.
That would be fabulous. And, if there's a time in the future that you'd like us